So, it's week 4 already, guys. It's going really quick. Now, this week you only have a discussion question due. What I suggest, highly suggest, at least start your pediatric assessment projects. Choose your diagnosis and at least start the paper. It's 250 words. Okay, you can at least start that or do the assessment part, because week 8, you got community with stuff. Many of you are in that also, and that has a project. And we know med search too, if you're in that too. Also, it's just going to get harder and harder. So it's a great week to do it. So I try to let you know that now. So we're going to be going over quite a bit today, chapters 37, 38, 39. I think of all of the chapters, 39's variations, which tells us the difference between adults and children. Those different little things that we need to know is probably your most important of all the chapters, although there's key concepts in all of them, right? Which I'll be showing you. So let's go ahead and let's do the Kahoots. Remember, you're going to get my recording from Monday, which is the PowerPoint. So you can go and listen to it. I was starting to run out of time at the end of it, so I rushed the last couple slides of it, but it's very self-explanatory. So you can go back and take a look at that. And then also you can also look at the Kahoots and the concepts we're talking about. So who wants to win a Kahoots today? Well, look at that. Frederica wants to go. All right, you can go. I'll let you. And remember, look at the questions, see what makes sense. And the one thing I can tell you about questions, if you have hearing a word, a description you never heard me talk about, that is never the answer in an exam or a quiz. Okay?
Yep. Hello.
I think that's the one hint that I can always give you. There's certain words, if you see them on exams, I never mention those things, so it can't be your answer. It might make sense to you, but if you haven't heard it, it's not applicable.
Thank you.
No, you're very welcome. So let's get going. We'll probably be done about 10 after, quarter after. And then give me a chance to get the ladies' room, and then we will start the math review, okay? And I think that will help. And in fact, I'll record it for all of you too, for those who cannot stay. Sounds like a bargain? So week 4, pediatric variations. I said chapters 37, 38, 39. It's a lot of good stuff. So early detection of a hearing impairment is critical. Which one is of primary importance? So when you see a child that's not responding, doesn't jump when he hears loud noises, has a problem speaking, what are you going to go and you're going to talk about? And what are you going to, detect first? Well, if you're not speaking correctly, or your, pronunciation doesn't get better as they get older, always check the hearing. If you can't hear, how can you pronunciate the words, right? So always hearing, speech, hand in hand. Remember that. Another multi, be a lot of them. A toddler goes to the ER complaining of fever, headache, a rash that's itchy with milky fluid all over it. What is your priority? What do you think that could be? It's a rash. It's papules. There's, liquid coming out. What do you think that could be? Probably it's varicella, okay? Even though we get varicella vaccines and you think there's no chickenpox, this is one thing that you can get, even with the vaccine, okay? So first of all, get a mask on you, all right? First, take care of you, and then put it on the child, and then move them to an isolated room. Every ER, every nursing unit has a reverse airflow room, which means the air from the room goes filtered outside and it doesn't come back in the hospital and spread whatever all over the place. Chickenpox is airborne, of all the things. You would think more contact but it's actually airborne. Good. Another multi. The child's playing outside. He runs into a piece of wood and gets this laceration all over the arm, and he needs stitches. What are you going to do? How are you going to help this child? I think you tell the kid they need stitches, or just going to start screaming, yelling, and crying and running away from you because they're afraid, right? So we're going to do a lot of things, but the one thing we don't want to do is restrain them to the point of mummy restraint, unless you have a very irrational, aggressive, autistic child or someone who cognitively cannot understand, all right? So we're going to put numbing cream on it, let them know that they're going to feel touch, no pain. Child life is amazing, but you don't want them to see those needles, right? This is one thing that you're really not going to share all of the equipment with it. You might show them hemostats, but don't show them what the suturing the little needle looks like, okay? And explaining things like that with a child, having child life there, it's going to be a very easy experience for you.
What is child life?
Hold on a second. A parent recognizes that the toddler has a speech delay compared to her older siblings. What is your priority? I'll explain it as soon as the question's done. Great answer. I like the question. So number one, remember, speech, hearing goes together. Get the hearing evaluation. It doesn't mean that you're not going to have speech therapy involved, okay? You probably will, but first, make sure that they're hearing. Child Life is a great group of people, professionals. They are at least a bachelor degree. They're up to doctorate degrees, and they teach children and help children to play according to developmental levels. They are there to show the child equipment, what touch is, what to expect, and all on their developmental level. They'll be blowing bubbles, or they'll be doing things when something else is going on for a distraction, and they get that confidence from that child, and they have time to sit there and do it, where you as a nurse in an ER don't have that much time as they do. They can do a one-to-one with them, and they really are amazing, amazing people. When they first came out, I was like, which was about the end of like 2009, 10, something like that. They came out. I'm like, who are these people in my room talking to my kids? And then I found out it was Child Life and realized that they are really amazing. If you have an opportunity to work with them, work with them. They're good. Multi-select. What are signs of an early indicator of impaired cognition? You know, cognition is all of your fine motor, your gross motor skills. These are part of understanding the younger child. Are they able to do things? Are they able to coo, right? But if they're not talking, which means something's wrong, they're unable to grasp objects, which should be voluntary by then, and because they cannot express themselves, these children are going to have some sort of behavior difficulties because they can't tell you what they want in any manner. And we know the older infant can, or the younger toddler, they can start to express it. So there are behavior difficulties because of that. A child is being treated for a fever. The reason for treating the child's fever is what? Do we need to treat a fever? The only reason why we need to treat the fever is because how do you feel when you have a fever? You feel horrible. Once the fever comes down, then these children are great. They'll start eating, drinking, and behaving normally, right? Then the fever goes back up, they'll sit in the corner again, stop drinking, stop eating, right? So the only reason is for that relief of discomfort. Now, I know many of you think you're gonna have a big seizure, right? I've seen 106.4, no seizures. It is a rarity that they have seizures with a fever. So when do they do these fever seizure thing? The only time is when you have a 0 temperature, normal, and all of a sudden it's 102. So the rate of rise is so quickly, the brain sparks, and that's when you have a febrile seizure. Once you have the fever, you are safe. Okay? An interesting concept, which I've taught many a parent about. Another multi. A child's complaining something is in their eye, causing tearing and pain. What do you do for that? You know, kids are always playing and throwing things around and running into things, falling. You know, there's always something going on. And we know eyes are very important because you only get 2 of them. Now, if it's floating around in there and you see it, you can take a piece of a tissue and get it out, okay? If it is stuck in there, leave it alone and you put what we call a Fox shield. It's actually a hard eye shield so that nothing can penetrate and it keeps it solid so you can't push whatever that is in further, okay? And always, any eye injury, you're going to check that eye for reaction to light. Is that pupil working still? Because again, that's another emergency if it's not. Separation anxiety in a child hospitalized. Which behavior indicates the stage of despair? Now, separation anxiety, there's 3 stages. So it's something that you need to look at. This concept, you're going to see it again. It's all about when mommy has to leave or daddy has to leave the child in the hospital alone. And they go through these different stages of almost what we call grieving. So initially, they're screaming, yelling, crying, and very upset. Then they start to accept what's going on. And then the age of the despair is they get regressed. They might start sucking a thumb, or they might, you know, they're potty trained and they have accidents as part of it. And sometimes the parents come back and they really are not interested that they're there. You know, and the parents get, well, I don't even need to be here. My kid don't want me. It's just because they've gone through this separation anxiety process, okay? A child with a history of abuse, which therapy explores emotional problems. And this is actually something a child life expert would do. And they would sit there with that child. Because remember, do children know when they're abused, really? Do they know good touch, bad touch, what's right, wrong? Many don't, right? But it's just play therapy. Just play therapy. I mean, sometimes we call it, you know, dramatic therapy, but it's mostly we're just going to play. Let's see what they do with the girl dolls and the boy dolls and how are you touching, right? And they sort of work with it that way to figure out what went on with that child. A multi. When can children react to the stress and anxiety of hospitalization? You know, kids know that they might have to go in, you know, have surgery or need to go get some procedures. They need to either have a quick in and out, or maybe they need to stay in. Like, when do you tell them? And when are they going to react to it? Well, you don't want to tell them too early. Absolutely not. Because then they're going to stress about it. But give them enough time to process it. So it's before and after that they're going to have stress. Only during? No. They're going to anticipate it. And when they go home, it's like post-traumatic stress syndrome. They still, especially if there was a bad sort of experience when they're there, and they do have stress going to the hospital. Unless they've been there and had a great time. But many children never been there before. Another multi. An adolescent goes to the ER for treatment without parents. How do you get consent for treatment? There'll always be questions on HIPAAs and consent on your NCLEX exams. This is just one of those legalities that as pediatric professionals, we need to know. So if an adolescent goes to the ER and they're 18 and they're competent, they can sign for their own treatment. Now, let's say they're younger and let's say grandma brought the child in because of whatever. You can call the parent and have two people listen and get the consent. Then let's say the kid came in on a helicopter trauma, and they're immediately in the trauma room. Well, the ER physician can do treatment because it's life-threatening. Okay, that's an emergency. And then later on, we will get the consent from the parents. But that initial, the ER physician can sign for it. A child's extremely fearful of hospitalization. What type of play explores these sort of feelings and fears and stress? And that's your dramatic play. That's when they're saying they're afraid of the X-ray machine or the IV going in, or they can show you with equipment what exactly they're afraid of, and then try to decrease that fear by doing different things, distraction, diversions, all that. When checking an IV in an infant, you notice the tissue around the IV is swollen. What do you do first? The IV is swollen. Remember, infants, 10, 15 mLs is a lot. 30 mLs is getting to be quite a bit of fluid. On an adult, that wouldn't matter as much. But whenever you notice swollen, stop it immediately because you don't want any more going in there. Now, when you're done and you note that it's infiltrated, yeah, you can elevate it. You can put on a warm pack. All of those things are good. And if it's a caustic type of IV fluid going in, we leave that catheter in there till we talk to the doctor. Sometimes we put medicine in there to decrease the amount of damage that medication could cause the tissue. In helping a child to adapt to a hospitalization experience, the best approach is what? Now, there's many answers here that we could say, but the first thing we need to do is keep that child on their daily routine. Be consistent. If possible, the same foods would be good too. Now, have the child bring in what they want with toys, etc., but the consistently, especially those toddlers, right? They don't like change. And then, of course, your preschoolers are a little bit less, but still, they don't like that change because it causes too much stress. So routine first and bring in stuff, food if they want, etc. So very good. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? What were you taught in health assessment, right? And what would you do if you find out they can't see there? And you can't even see the top line. At this point, you'll be notifying the physician so that they can check the eyes. A multi. Nursing care of discharging a child to home would include what? And we know we prepare for discharge by starting to teach the moment these people walk in the door, for sure. So provide written instructions to only the parents. Well, what about the child? A lot of children want to be involved. Why don't they get them? There's no reason why not. Of course, the telephone numbers. What do you expect to see? And then make sure, do you understand what you need to do? What is a 3-year-old's biggest stressor of being hospitalized? Death rate at the end of toddler, beginning of preschool. Very fragile age. What is their biggest stress, biggest fear? And if we can, we try to not, but it's when the parents have to go home. Parents have to work, many of them, Many of them have other children, other responsibilities, and they do have to leave sometimes. So that separation is the big thing. That's when you're going to see separation anxiety. And that's why we study that, because kids do really go through those stages. Another multi. What is the best way to alleviate the stress and anxiety of a hospitalized child? It's like trying to pick the best answer, isn't it? So you are going to keep them on the same routines, like I said, keep the parents there if possible, and always get on their level, developmentally appropriate terminology to know what's going on. And they used to do all of these, like starting IVs and NG tubes or Foley catheters, whatever, in the room. But we found out we need to keep that their safe space. So we do not do any invasive procedures in the child's room unless it's an emergency. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention would be what? Like, why is that string there? So always ask. When you see something you don't know, just ask parents. And most of all, parents appreciate that you saw something and you did ask. They will have a higher feeling of you. I mean, I've seen so many crazy different things, culture stuff, and I ask. And then I'm saying, oh, I don't know. I've never seen it before. And they're willing to tell you and share about their culture. How can hearing impairment develop? And it's from anything. You could have it at birth. It could be a missing ear or canal. Ear infections is huge when you're having chronic ear infections that they don't follow up to make sure those infections are gone and they continue. It can cause a hearing loss. And then any sort of illness, mucus up in the ears again, which goes into ear infection. So all of the answers, very good. Which urine collection method on an infant is most accurate? Remember, infants don't have immune systems, right? So we need an accurate urine specimen if they're complaining of fever and could be possibly a urinary tract infection. Parents don't want to hear it, but straight catheterization is the most accurate. Because why? We're not doing a bag urine. I mean, parents want us to. I mean, how are you going to do a midstream on an infant? Hold the baby up, wait till it urinates, let it pee, and grab some? I mean, it can't happen. Same thing as a clean catch. The bag urine has the body, has bacteria, on the skin. So is it a true and real culture report? No. So straight calf, you get a one time and it's accurate and you can treat it effectively first time and you could protect the kidneys, right? A multi. What is the purpose and function of the family? And we talk about family with pediatrics because it's family-centered care, right? We're not just taking care of the child. We have a family. And it's the family that stops a lot of nurses from going into pediatrics. But I have met some beautiful, wonderful families. Even the most difficult ones become wonderful. But what does the family do? It has that safe environment for growth and development. It's where they have that emotional comfort in their identity, and they get their values, their attitudes, and beliefs from there. So very good. Good job. The primary goal in caring for the child with cognitive impairment is to what? You have all different levels of cognitive impairment, from very mild to very severe. And years ago, we used to take these children, bring them to a daycare, and they would feed them, bathe them, get them out of bed, and not do a whole bunch. Today, these children are going to specialized daycares, getting speech, physical, occupational therapy, because some of these kids that years ago would not have the ability to have a voice, today do, because of, we know that these children are smarter than what they can express. There are nonverbal children that are very smart and know things, but how do they talk? Well, that's when you get that electronic little pad, and they can tell us what they want, what they need. And they've got senses of humor, and they will actually make you laugh. I've met quite a few. So many infants require oxygen. What is the best tolerated? And of course, accurate too. Many infants are born with little respiratory distress, and they need a little bit of oxygen just to help them. And that would be the oxy hood. Now, the oxy hood is that clear plastic thing, and we put like a little sensor there, and we know how much oxygen is going there. The blender and the sensor tells us what it is. These kids can look around, suck their fingers, suck a pacifier. They're happy, and they are looking normal, right? Acting normal, and they got their little oxygen they need. What is the best practice for school-age children with special needs? I mean, this could be a kid who was born and, for instance, a myelomeningocele, and they have very little movement from their waist down, and they're in wheelchairs. Does it mean that their brains are not mature and cognitively smart? No, some of these kids are brilliant, but because of special needs, should they be placed somewhere else? Oh, absolutely not. These children need to be in regular classrooms because it promotes them to be the best they can be, right? Some kids can't be in regular classrooms, but many can be. So that's what we're doing today. Multi. Collecting a heel stick blood specimen on an infant. We do not have to do an anti-cube stick for blood on babies unless it's for some blood coagulopathy, like a PT or PTT. But everything else can come through a little stick on the heel. So, hospital approved heel warmer, not a hot washcloth or anything of that sort. You could burn these infants quick. We go on the outside of the heel, not in the middle, because that's where the calcaneus bone is, and they can puncture and cause an osteomyelitis in the heel. And then only use that lancet that says infant on it, and they are very clearly marked. The other thing is you put that leg down below the heart. I usually sit on a chair below them and very softly squeeze them, and then I get the little blood and the little tubes. You can do a complete chem profile CBC with 1.2 mLs of blood. It's hardly anything. Referrals for cognitive impairment should occur when? You need to start as soon as you see something's going wrong. And even if you're not sure, get an evaluation. So the quicker we do it, the quicker they catch up, because children are brilliant. A client with mild intellectual disability. Remember, children become adults, and some of them do have, some sort of cognitive, intellectual disability. Many of these you will see with mild can live on their own, but they're going to have some sort of person watching over them, making sure that nobody's taking advantage of them. Because a lot of times these either sexually abused or they're taking money from them, and they're, doing things because they don't know better. So these people do need someone as their guardian watching over them, because parents don't live forever. So sometimes it's a guardian. Now, Down's children have frequent upper respiratory infections. Why do you think? I mean, we know what they look like. Big round faces, they've got these oval eyes that are slanted, they've got a big tongue, they've got this tiny little nose. What is it that causes it? And it's that flat, underdeveloped nasal bone. They can't get rid of the mucus, so it goes back and it falls on the trachea, up into the ears, and it's all upper respiratory with them because of their bone in their nose. Not the tongue, it's the nose. A multi. What would be included in the care plan of a patient with moderate cognitive impairment? So we have found that structured schedule. I mean, I've worked with this little 5-year-old boy who was Downs and autistic. And he would come into the daycare where we had our clinicals that was prescribed daycare. Beautiful, wonderful facility. They took good care of their kids. And that kid had been coming there since he was very young. And he would come in off the bus, take off his backpack, he'll put it in his little cubby, sit down, wait for the nurses to take his vital sign, and then he would get up and go and he would play. I just said Down's autistic child that does it because it was structured that way. Now, the other things we have to be concerned with is making sure they have appropriate toys, good activities that they can do that teaches them things. And, they don't like lights, they don't like sound, they don't like touch, all of these things. So you need to expose them to those things so they get used to it. And actually, this boy would go around hugging some of the nurses when they were on duty. So very unusual, but because of that early intervention, right? And that daily structure. Another multi. Why do children with Down syndrome have frequent respiratory infections? What did I say? So why number one is that nose, but it is that mouth breathing, and they're not through the nose, and they're not getting rid of the mucus at all. And again, because that nose is stuffy, again, has nothing to do with the tongue, believe it or not. A multi. Autistic children demonstrate which behaviors? Autism in children is usually not diagnosed and given that label on that child till about 2 years old. They need to see what cognitive development that they do have. And again, these children, hopefully, we've seen early signs and have them in early intervention that can help with them. But these children many of them don't talk. Many of them just grunt or maybe 1 or 2 words, not much more than that. Again, they don't like to look at you. They don't want you to look at them with their eyes. They play alone by themselves. And even when you call them, they're not going to come to you. It's just part of it. Again, sounds and lights and noise and people, they do not like. So you need to expose it to these children so they get used to it. Another multi. Children with autism have better outcomes if? Keep them on that routine, teach them how to talk, how to express themselves, because then they'll be less frustrated, right? And even though they're autistic or whatever the condition is, never accept bad behavior. Always tell them what they're doing wrong, have them sit, again, that 1 minute, per age of child, same thing, unlike a timeout, and explain what they had done wrong. And they do. They're not going to do those behaviors again because after a while, they remember and learn. A multi. Fragile X. Now, Fragile X is like Downs. It is the second most common chromosomal cognitive deficiency in children. There are little subtle differences with it. They do have intellectual and learning difficulties, yes. Diet has nothing to do with these children. And they'll have like big ears and big jaws. The one thing about Fragile X, difference between Downs and Fragile X, is Fragile X tends to be aggressive and requires medication to keep them calm because they're so aggressive. That's the difference. And they live a full life. So this is a child that we would tell the parents they need to make plans for future, what's going to go on. What causes autism? Isn't that the question that we would love the answer for? And we don't know. Genetics, we don't know. Abnormalities of brain. And there's more boys than there are girls. It's mostly boys. Ways children with hearing impairments communicate with each other. Any way they can. And children with two different languages sitting next to each other, they can play and communicate. How? I don't know. Kids just know it. And it's through all of those and a lot more is the way they do it. And they're okay with it. Amblyopia is an eye problem. You're going to see nearsighted, farsighted, strabismus, nystagmus, amblyopia. Get familiar with those names. You're going to see them again. Now, the other word for amblyopia is a lazy eye. That means that muscle, maybe it's sticking on the outside or the inside. It's just the muscles are weak. So how are we going to strengthen a muscle? We need to exercise it, right? Cover the good eye, let the bad eye work, and it will strengthen the muscle, and nothing else is needed. All we need to do is cover the good eye a couple times a day, and the doc puts them on a routine. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? No, always go back and I'll add questions here and there that I think are important just to keep reminding you. And this is the one you're going to let them play. I mean, telling a kid it won't hurt, they're not going to believe you. Let them play with this stuff and they're going to have more faith in that, okay? Not going to hurt. Yeah, I've heard that before. What child may be more stressed when hospitalized? One of the chapters talks about you could go to outpatient, you go to urgent care, you can go to ER, just regular hospitalization, and talking about the stressing of those environments. So a kid who needs to go into a hospital to be admitted, the kid who's going to be upset more is the kid who's been there before and maybe has had a bad experience. Many kids and children go into the hospital, they just see all of the bright colors and toys and things, maybe a boat in the lobby, and they're like, oh, maybe this is fun, right? But they've been there like with sickle cell, and they've had bad experiences trying to start an IV, nobody can get it in. They're going to be the one who's stressed, not the kid who's never been there before and doesn't know. A toddler has a hard time fixating on a single point. The child's eyes crosses. So again, this is another one of those things I'm telling you about, crosses. They can't focus good, which means depth perception is off. You have something called nystagmus, and they sort of move back and forth. But strabismus is the eyes just trying to get where it needs to go to focus. And that's what that means. Good. A multi. Safety in administering medications to children include one of the things that I have seen changes is physicians writing medication orders for children have to put in the order how many milligrams, micrograms per kilogram, per dose, per day, whatever their need to do. So then you're going to check that out. The pharmacist checks that out, and the physician did it. That's 3 checks. So now we know that dose is safe. So calculate that dose and always check that name band. Now, some of the kids not going to answer you, so that's not consistent. So name band always, and make sure you check the dose. And when you're in doubt, ask another nurse. What can help the parents to make a baby swallow their medicine? A lot of medicines just and spit it out, right? How are you going to get it in there? And they swallow the whole thing. This is something I've been doing a long time, and before COVID and infection control, I used to do it myself. But today what I do is I tell the parents, I'm going to put it in the side of their mouth a little bit, not in the back, because they're going to vomit it all over. You squirt a syringe or whatever, and it's going to come back out. Side of the mouth, have the parent take a deep breath quickly, and they'll swallow it. So it's pretty neat the way they do it. So teaching the parents, you can pinch the cheeks, you can hold them down and do all of it. But that quick puff of air works amazing. So the treatment for amblyopia involves, what did I say? Amblyopia, a lazy eye. And again, cover the good eye and let the lazy eye work. Let the muscles get stronger. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important to remember about that? Remember, like cognitively impaired children, are they aware of their environments? Are they aware of good touch, bad touch? Who should do what? Not really, right? So they need a well-defined concrete code of sexual conduct. These children are abused, whether it's male or female, they're abused. So it's something that they do need to protect them. Another multi. A child is asking mom about his sibling in the hospital. How can you alleviate his stress and fear? Through COVID, this was huge because nobody could go to the hospital, right? Even parents couldn't get in many of the time. So this child at home is scared. His brother, last thing they saw me was taken away in an ambulance, right? He's worried. Well, I would do many different things. Have the child in the hospital if they can or are aware. Do something for the kid, write his name, set it on a piece of paper or a card, or have the kid at home do the same thing. I used to send ribbons home for the girls if I made ribbons for the sister at the hospital. But if they have to come in, let them know what they're going to see. What if they're intubated? What if they have monitors? I mean, they need to be prepared so they're not afraid, because they're going to see him and go, oh my God, look at him, he looks horrible. And you don't want to stress that child out. Multi. What are some best practices when a child is in pain? We're going to do a little bit of everything. Now, give the medicine as ordered. If a kid just had surgery, give it. Don't let that child ask for it, because many a times they won't, because they're afraid they're going to get a pinch. They're going to hurt, right? Repositioning helps. Elevate the head of the bed. They've had abdominal surgery. Turn them to the side. And then distraction. Give them a video game. Give them crayons, coloring, watch TV, whatever you need to do. And doing those post-op things, like instead of spirometry, don't try to make a kid or an adult do it unless they've been medicated. They've had abdominal surgery. Blowing that thing in and out hurts. So make sure they had their pain medicine. Especially you want to get them out of bed and ambulate. Same thing. Give them their medicine. Another multi. Child can be critically ill for long periods. How do you prevent pressure ulcers? And yes, children can get pressure ulcers. Some kids get acutely ill and, they're placed on these machines to help them survive and they can't move and they can get these pressure ulcers. So again, keep them clean and dry. Turn them as well as you can. I prop them with stuffed toys, blankets, pillows, all different things to help them, like the toy to get the ET tube, to hold that there so they can see their little dog or whatever it is. And then draw sheets. You don't want shear injury from moving them up and down. So yes, very good. Young children can be stressed by being in a hospital. How can you decrease the stress? I think we got this one down pat now. Keep the routine, have the parents, and then let them bring the toys as they want. But the most important is having those parents stay there and the routine. And last question, what type of play allows children to express their fears of hospitalization? That actually looks like the playroom at the hospital that I worked at. They had an amazing playroom. And it's called dramatic play. Let them act out what's going on. Let's see how we did. Chad, number 3. Good job, Chad. Number 2, Jess. And number 1, Ashley. Good job, Ashley. Number 4, Kendria and Yo. Okay, just to let you know, I cannot tell grades what you've gotten. Grades are going to be posted Saturday after I do an exam review analysis. You should have your grades by 2 o'clock in the afternoon. Okay. Grades were right around the medium of 80, 81 for everybody. If you're absolutely freaking out, I could say, okay, or you didn't make it. That's about all I can say. All right. I've been told by the boss, because I used to give out grades. I can't, or else I would. So anyway, you all have a good day. I'm going to go to the ladies' room, come back, and I'll be here for math if anybody wants to learn some more. Okay. I've got a brand new worksheet that I just made, and I think it's going to help for you to understand. As I said, let's do it together so I have the answers on the sheet. You're going to help me make them.